Welcome to our channel. Colon cancer is one of the most prevalent forms of cancer worldwide, and remains the third most commonly diagnosed cancer in both men and women in the United States. The colon is part of the digestive system and is also known as the large intestine. Colon cancer develops when the cells lining your colon begin to grow abnormally and out of control. This type of cancer usually starts as small, non-cancerous growths called polyps, which can gradually become cancerous over time. In this video, we'll explore the ins and outs of this disease, from its warning signs to the latest advancements in screening and treatment. Your health is worth it, and knowledge is your first line of defense against colon cancer. So let's first start from the essential warning signs of this deadly disease. Change in bowel habits. If you notice changes in the bowel habits, such as diarrhea, constipation, or a change in the consistency of the stool, that lasts for a long time, it could be a sign of colon cancer. Research published in the Journal of the National Cancer Institute suggests that changes in bowel habits are among the earliest signs of colon cancer. Blood in the stool. The passage of bright red blood in the stool is often associated with bleeding in the lower gastrointestinal tract. Blood in your stool or bleeding from your rectum can be a sign of colon cancer. It's important to tell your doctor if you see blood when you go to the bathroom. According to a study in the American Journal of Gastroenterology, rectal bleeding is a significant symptom of colorectal cancer. Unexplained anemia. Anemia is a condition characterized by a low level of red blood cells or hemoglobin in the blood, unable to carry oxygen to your body. Colon cancer can cause bleeding that leads to anemia, which can result in symptoms such as fatigue, weakness, shortness of breath, and dizziness. Research in the European Journal of Gastroenterology and Hepatology highlights the link between colon cancer and unexplained anemia. Abdominal pelvic pain or bloating. If you have ongoing pain or discomfort in your belly or feel bloated all the time, it could be a sign of colon cancer, especially if it doesn't go away. This pain is often described as colicky, meaning it comes and goes in waves and may be relieved temporarily after a bowel movement. The pain can be located in the lower abdomen, on the side where the tumor is situated. The sensation of bloating is due to a buildup of gas and stool above the obstruction. Unintended weight loss. Unintentionally losing weight, particularly if you're not dieting or exercising more, may indicate a health problem, such as colon cancer. Colon cancer, like other malignancies, can alter the body's metabolism, leading to increased energy expenditure, reduced nutrient absorption, and muscle wasting, all of which contribute to weight loss. According to a study in the Journal of Clinical Oncology, unexplained weight loss can be an early warning sign of colon cancer. Vomiting. In advanced stages of colon cancer, particularly if the tumor obstructs the bowel or spreads to other organs such as the liver, vomiting may occur as a result of bowel obstruction or other complications. In such cases, the tumor may cause a blockage in the digestive tract, leading to nausea, vomiting, and abdominal distension. Research in the Annals of Oncology suggests that persistent vomiting can occur in advanced stages of colon cancer. Detection and screening of colon cancer. The goal of screening is early detection, which allows for timely intervention and treatment, ultimately improving health outcomes. Doctors use different tests to screen for colon cancer. Colonoscopy. This test involves the insertion of a flexible, lighted tube, colonoscope, into the rectum to examine the entire colon. During the procedure, the doctor can remove polyps and take tissue samples, biopsies, for further examination. It's one of the best and most comprehensive ways to find and remove polyps before they turn into cancer. Research published in the New England Journal of Medicine confirms that colonoscopy is highly effective for colon cancer screening. Fecal occult blood test. These tests check your stool for tiny amounts of blood, which can be a sign of colon cancer. A positive result typically leads to further evaluation with a colonoscopy. Computed tomography colonography. This is also referred to as a virtual colonoscopy. The test uses special X-rays to take pictures of your colon and requires a skilled radiologist for interpretation. Who is at risk for colon cancer? There are several possible risk factors for developing colon cancer. Age. As you get older, the cells lining the colon may undergo genetic changes that make them more susceptible towards getting colon cancer. Regular screening starting at age 45 to 50 is recommended, in order to detect and prevent colon cancer at early stages. Family history. A family history of colon cancer or colorectal polyps can significantly increase an individual's risk. Inherited genetic mutations are passed down through families. A meta-analysis in the Journal of the National Cancer Institute highlights the strong association between family history and colon cancer risk. Personal history of colorectal cancer or polyps. Individuals who have previously been diagnosed with colon cancer or certain types of colorectal polyps are at an increased risk of developing the disease again. This underscores the importance of regular screening. Inflammatory bowel diseases, IBD. Chronic inflammatory conditions of the colon, such as Crohn's disease and ulcerative colitis, are associated with an increased risk of colon cancer. Inflammation over an extended period can lead to genetic changes in the cells lining the colon, increasing the likelihood of cancer development. Lifestyle factors. Habits such as smoking, drinking, eating too much processed foods, being overweight, and having a sedentary lifestyle have been found to be associated with an increased risk of developing colon cancer. Studies in cancer research and gut highlight the impact of lifestyle factors on colon cancer risk. Is it possible to treat colon cancer? Yes, the treatment of colon cancer is possible, and recovery is achievable, particularly when the cancer is diagnosed at an early stage. Treatment options for colon cancer depend on several factors, including the stage of the cancer, the location within the colon, the overall health of the patient, and individual preferences. Treatment typically involves surgery, chemotherapy, radiation therapy, or special drugs. If you're worried about your risk or have symptoms, talk to your doctor. They can help you figure out the best steps to take care of yourself.
If you find this information helpful, please hit the like button and subscribe to our channel for more informative content.